Let's discuss the pathophysiology of anaphylactic shock and anaphylaxis. Anaphylaxis is a systemic and severe allergic reaction, and as with any allergic reaction, the pathophysiology is related to a person's own body's reaction to the foreign materials. Substances introduced to the body interact with the mast cells, which are part of the immune system, and basophil cells, which are part of the pituitary gland. The substances would interact directly in the case of a non-immune anaphylaxis. Also, this can be called an anaphylactoid or pseudo-anaphylactic reaction. But in an anaphylactic or immunological reaction, antibodies bind to the antigen, and the antibodies bound to an antigen interact with mast cells and basophil cells. In either case, the mast and basophil cells proceed to release a variety of compounds. This is a process called degranulation. Histamines and other inflammatory mediators trigger various symptoms as they travel throughout the body. With the cutaneous system, the skin, you start to see hives, flushing, itching, burning, and swelling. Respiratory system, you see bronchial spasms and swelling in the upper airway. A person might demonstrate shortness of breath, wheezes, coughing, or stridor. These symptoms can become so severe that a person stops breathing. We call that asphyxiation. With the cardiovascular system, coronary artery spasms and vasodilation cause a drop in blood pressure. They can also cause dysrhythmia, myocardial infarction or heart attacks, tachycardia, bradycardia, and cardiac arrest. If the blood pressure drop is severe enough, then the person is in shock. They may lose consciousness or feel lightheaded. Dilated blood vessels in their brain may give them a headache. Vasodilation and release of fluids from the blood into surrounding tissue causes the drop in blood pressure that we call anaphylactic shock. Gastrointestinal symptoms are really common as well. Abdominal pain, nausea, vomiting, diarrhea. Anxiety, confusion, panic are all common neurological symptoms. Anaphylaxis is an emergency medical condition requiring immediate medical attention. Anaphylactic symptoms may reappear within the next 72 hours of the initial event without another exposure to the antigen. This is called biphasic anaphylaxis.